The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Colostrum is in effect a whole food that is minuscule in size yet extremely high in vital nutrients, growth factors, and antibodies essential for early development of newborn life. It is responsible for triggering at least 50 biochemical processes in a newborn's body, which will provide the lifelong foundation of the growth process and the immune system. Bovine colostrum is useful for boosting immunity, preventing autoimmunity, tissue healing, and as an agent for fighting infection and disease. AOR's high-quality North American colostrum, derived from livestock raised under the best conditions and processed using the most rigorous quality control conditions, is the clear choice for purity and potency. Get yours today at your local retailer or online at aor.ca. Hello, and thank you for tuning in to another episode of Supplementing Health. Today I am joined by Antoinette Falco, naturopathic doctor, to discuss ways to empower women to use their menstrual cycles as a diagnostic tool to understand their hormones and reproductive health. Dr. Falco believes health is one of the most beautiful gifts, and we all deserve to feel our best and live life to its greatest potential. Welcome, Dr. Falco. Thank you so much for joining me today.
Thank you. Thanks for having me.
So before we get started on the conversation, I'd love to know how hormonal health and fertility became a passion of yours.
Oh, yeah. Well, I mean, like many practitioners, I would say it starts as a personal journey when you're in your early 20s and you're navigating the world of hormonal birth control, non-hormonal birth control, which way you want to go to help give you the reproductive choice that you're looking for. So at the time, I had just started naturopathic school and I had been recently diagnosed with Hashimoto's and hypothyroidism. And at the time, I was just kind of lost to the understanding of how that hormonal condition affects my periods and my cycles. And, fast forward to getting more lab tests done through my work with a naturopath at the time. And I learned that, the real answer to treating my hormonal condition was actually to approach it in a more holistic way, to look at all the systems in my body and, to consider whether or not hormonal birth control is going to further complicate that situation, or like what it was actually going to be doing for me. And I was just really thankful that I worked with someone at the time that, told me that maybe hormonal birth control wasn't the direction that I wanted to go in. And then through my own healing at the time and then starting practice, I started noticing that there was this trend of a lot of women who are coming to me who either were on hormonal birth control and wanting to come off because they wanted to start their families, or they were having terrible symptoms, terrible side effects. And so from there emerged, the work that I do, which is around helping women transition off hormonal birth control. And then with that, I received extra certification in teaching the fertility awareness method. And the fertility awareness method is what I teach women as their form of natural birth control that is highly effective, but also as a way for them to understand their reproductive health. And yeah, that's where we are today.
I think it's really interesting how much information is now becoming mainstream about hormonal birth control. In the past, women have just been kind of told, like, this is your only option, and it's used as a solution for so many things, even beyond just fertility control, right? People use it for acne and for other conditions that come up. So I know
Yeah.
I've been reading a lot lately about utilizing your hormone cycles to manage your fertility. But are there other benefits to charting your cycles?
Oh yeah, definitely. So the understanding your reproductive health is probably the most significant one in that, it can also help you understand, like, for example, if you need to have a blood test done to test your hormones, like taking your blood on any random day of your cycle is going to give you different results. So by understanding your cycles through charting, you can know, okay, when is the best time for me to check my estrogen levels? Because you understand that that's the part of the cycle where estrogen is the dominant hormone. Or, when am I going to test progesterone? Well, progesterone's correlated with ovulation. So you need to know when you ovulated in order to count 7 days after that to then get a progesterone test. That's going to give you the most information, right? Like yeah, we could in theory get a blood test done any day, but is the result or the value that you get going to be helpful to you if it's not done on the right day? No, it's not. So I think that charting helps give you this tool that then can guide you in terms of lab tests you might want to run or treatments that you want to do. Like if you've got any, abnormalities or atypical menstrual patterns, whatever they might be, if you've got PMS, whatever's going on, I think, it is the fact that it could be used as a diagnostic tool, because your cycles are a vital sign. And this analogy has been tossed around a lot lately, but I truly believe it really does capture how a woman has this extra vital sign that makes her have this next level of knowledge around her health. And it's not just her reproductive health. So I think that's pretty fantastic. And then, of course, like charting. So charting really can be used in the three categories. We talked about using it to manage your reproductive health. But then I think the other two categories are using it for hormonal birth control. And then the other one is like using it to plan a pregnancy. So this depends on, what your intentions are, what stage of life you're in. But I would even take that a step further and say women can use, so sorry, when I say charting, I'm referring to fertility awareness method. I just wanted to keep that clear in case, in case there was confusion with some of the listeners. But yeah, going back to, you could use it for any stage that you're at in your reproductive life. So for example, if you're wanting to navigate the transition into menopause, you can be charting your cycles to help you with that. If you're postpartum and you don't have a period and you want to be tracking the return of your fertility, it's charting becomes very helpful there. Or if you don't have normal cycles, and charting can help you understand, okay, where do I need to do more work and where do I need some treatment potentially to help bring my cycles into normal ranges.
So beyond like recording the start and end of menstruation and maybe some symptoms, what are some of the other details that women should consider including in their chart?
Yeah, that's an excellent question. So most people, like when they think of uh, charting, they think of, using an app, telling the app when your first day of your period is, and then telling the app when your last day of your period is, and then not really tracking anything else on top of that. But when in my practice and what I teach through what's called the Justice method, which is a form of fertility awareness method, we teach to record three important fertility biomarkers during your cycle, and that is your cervical mucus patterns, your basal body temperatures, and as well the position that your cervix sits each day of your cycle. Now, those are the three most common, but I would say in terms of what is the most important, cervical mucus patterns is definitely the most important. It's your number one fertile sign. It is what's linked to your hormone production throughout your cycle, and it's what's linked to a healthy cycle. Yeah, and then in terms of other details, I really do encourage women to add in some of the other lifestyle factors that go into their day to day. So that could be things such as like what type of exercise you do, what days you do exercise, are you consuming alcohol? If so, for example, alcohol is one that can throw off that fertility marker being your basal body temperature, and like basal body temperature is helping us pinpoint when ovulation is. So we want to be recording the lifestyle events that happen in a cycle so that we can use that to help us validate the biomarker data that we're collecting regarding like cervical mucus, temperature, and cervical position. And then some other things to be recording, of course, is like if you had a bad food day. So a lot of people don't realize this, but if you have a sensitivity to a certain food, or you know that sugar doesn't react to you. I mean, most people sugar shouldn't react well to, but we can all make the case of why like a chocolate bar here and there is needed in our lives. But basically, that can alter your cervical mucus. So, or if you have like a gluten sensitivity, for example, or, you have a dairy sensitivity, like those can affect your charts from month to month. So it's important that you're recording all of that in your chart. If you're sick, if you traveled somewhere, your environment's different, that's going to throw off how your body responds. So yeah, those are important things. So when I talk about charting and when I talk about fertility awareness method, it's really like putting everything literally on a chart or on your to keep record of, so that you can be monitoring your fertility month to month or cycle to cycle.
It's so fascinating how sensitive our bodies really are. Like when I first started reading about basal body temperature, I was so surprised by even waking up 30 minutes later, how it can change where your temperature comes in at, right? Or that you can't get up to go to the
Mhm.
bathroom before you take it. Like little things like that, that if you but didn't look into it like the proper way, all these things affect um, the data that you're collecting, right? So, and I didn't realize about the food sensitivities one either. So it's really
Mhm.
interesting to learn all of those little details that actually impact your hormonal health and your reproductive health that way.
Mhm.
So the other thing you mentioned was the cervical position. How do you chart that?
Yeah, yeah. Well, so checking your cervical, the position of your cervix is like you want to get yourself in a certain position, and you want to use, insert one finger in, and you're measuring for the opening of your cervix, which is called the cervical os. You're feeling it with your finger and noticing like what direction it's sitting in. So is it forward? Is it like more towards you, like you can feel it easily? And is it open? And the way most women can chart that is just by like drawing a circle, and like drawing like the opening and drawing it like almost like a compass. Or people just can record words. They can say like, it's forward, it's open. And what we're looking for is we're tracking those changes around like leading up to ovulation, because during ovulation, your cervix actually is going to sit forward and it's going to be more open. And then like as the cycle goes on, like it moves more anterior and it goes high. So it's going to be harder for you to feel.
Interesting. I mean, that makes sense from a uh, biological standpoint. It would be open to allow the sperm a better chance at getting towards the egg and fertilizing, correct?
For sure. Hmm.
Okay, interesting. So then is there an ideal day within your cycle that you should start charting if you haven't been to date?
I mean, I would say like start the first day of menstruation, which is the first day of your period. And that's your cycle day one. That's the first day of your chart. And that way you're recording menstruation, what happens every day that you bleed, what do you get PMS, like did you get pain, what's going on those days, and then then you continue and you track your mucus, you basal body temperature. You don't have to be recording during your menstruation, because that's usually when your temperature is coming down from the last cycle. But definitely you want to start recording like towards the end of your period. You want to be taking your temperature and plotting that on your chart. And then yeah, at the start of your next period, that's when you're going to start another chart, and that would be chart 2.
As I've been reading more about this charting method, I've found it very interesting just how effective it can actually be when you're tracking all of these different factors that play into it. So what I was wondering is, what are the benefits of charting over fertility methods beyond, um, I guess, basically just birth control or fertility?
Yeah. So the charting that I'm speaking about is a symptothermal fertility awareness based method. So this is This is what's been, as you said, it's well researched, and it does have a very high efficacy rate as a method for birth control. There are, of course, some distinctions that need to be made when we're talking about efficacy rates. So, you want to make sure that you have learned the method correctly and that you're practicing it according to the rules of whatever method you learned. So, sometimes people will say like, oh, but it doesn't work, or so and so that I know got pregnant using that method. I always go to, okay, but like, who taught them the method? What method was it? And were they doing it correctly? Because just like hormonal birth control, if you don't take it at the right time, you are every day, or you don't take it every day, we reduce its efficacy. So when you see, 98.2 or like 99.2% effective, when you see like rates that high of efficacy when we're talking about fertility awareness method, that is referring to perfect use with abstinence during the fertile window. So if you're using it according to that, like, yes, you will have the high efficacy rate. If you are not using it according to that, or you are using, let's say, barrier methods during your fertile window, like, well, you're not using the method to its highest efficacy. And so it's just really important to differentiate that when I'm talking about FAM, because there could be some misconceptions around that.
So, do you use charting in conjunction with other treatments or supportive tools for your clients?
Yeah, definitely. So I primarily trained as a naturopathic doctor. So after I received my FAM certification, and now I would say that almost all of my patients like go through, my introductory FAM presentation where I teach them to chart, and it's purely for, I want them to be involved in like their treatment journey and their health journey, so they understand what's going on. If a woman comes to me saying that she's experiencing like a week straight of spotting, for me it's important to know, okay, what days exactly is that? What's your cervical mucus pattern like? Like, I need more information. So I'm going to teach her to chart, and then as I start to see issues with the chart, that's where I'm going to recommend, potentially a vitamin, a supplement, a herb, maybe some homeopathics. And I want her to record on that chart, this is when she started it. And then I want her to start to track the changes, because it's pretty fantastic when you can start to see those cycle parameters shift into more normal ranges after somebody has initiated treatment. So that is something that I think is really cool about charting, and really awesome that, I'm teaching women this way of using their charts as essentially their own marker of their health, their own, diagnostic tool, if they will. Because once I teach a woman like, this is what a normal cycle looks like, and then she may or may not have that in her cycle, like, that's when she's reaching out to me being like, okay, this is what's going on, like what could it be? And then usually it's a conversation of, okay, well, like, what was going on in life at this time, like, tell me a bit about this. And then usually together we're coming up with exactly what's going on and exactly what needs to be done. And it feels less of me as the doctor telling them like, this is what you have to do, and more like she is involved in her hormone health journey, in her reproductive health journey. And I love that dynamic.
I think it's really exciting, the shift we're seeing to patients being more in control of their health, and particularly women's health, because traditionally or historically, menstruation was very much a taboo topic, right? And it was kind of seen as an ailment or a condition, just like pregnancy was for the longest time, right? So it's really great to see that shift and that power being kind of returned to the people who can control them, right? Like the women that are dealing with these conditions, if you will.
Hmm.
Um, so, if a woman is coming off of hormonal contraceptives, is there a waiting period before she should start using charting?
That's a good question, and it's one that I do get asked often. There's a transition period in terms of what's going on in your body and your own cycles getting back to their normal rhythms. But there's no waiting period in terms of when you could start charting. You could start right away the day that you take your last, your last pill. And sometimes, actually, if a woman's feeling anxious or overwhelmed about charting, I may recommend that we do the introductory session when she's in her last month of taking hormonal birth control, and then it gives her time to make sure she understands the method, and then even gives her a couple weeks to start recording. Right, a lot of fertility awareness method is making sure that you go through the observational routines for checking mucus in the correct order, that you get into the routine and the habit of taking your BBT first thing in the morning. So while the data that we get when you're on hormonal birth control isn't going to give us much information. It's about practicing the method before you actually come off, and then you will likely see changes happening to like your mucus patterns and your temperatures, like just in the nature of your hormones getting back to what their baseline is.
At what point do you consider the new data after they're off birth control somewhat reliable?
Yeah, so I guess it depends, like reliable, like what you're asking, like reliable for using, like are saying using it as a contraceptive, or like reliable for just like
For
monitoring?
reproductive health, so whether
Yeah,
they want to do it for pregnancy or for re- um, contraception, either or.
yeah, right away. Like right away. I think we can there's information about how it can take up to a year for women's cycles to go back to normal after hormonal birth control, but there are still some women who they're going to ovulate that first cycle off of the pill, and that's just how their body is, and they can still they can get pregnant at that time, and then for some women it takes longer. They might not get a period for a couple months, so but we can be tracking your biomarkers like right from the beginning, and we can be monitoring those shifts in hormones right from the beginning.
Earlier, you had mentioned that it can also be used like postpartum, premenopause. What are the benefits after pregnancy to continuing tracking?
In postpartum, like often, at your 6 week follow up with your doctor or OB, that's like after you had a baby, they're usually asking you, okay, what is your method of birth control that you would like to use? And at that time, some women are put on, the mini pill. They might get an IUD. That's when they have to make the decision of what they're going to do. And then I think a lot of women don't know that they can use fertility awareness method as a reliable tool for pregnancy prevention at that time. And then also I've had women who postpartum, their babies are, approaching a year, and they're starting to think, okay, we want to plan for a second baby, but like I don't have my period back yet. So, what do I do? So we're not trying to rush the onset of your period and your cycles like postpartum, but we want to be tracking your cycles, and we want to be paying attention to your mucus patterns, because what tends to happen is women will ovulate before they get their first period. So it is possible to conceive before you get your first period postpartum. So definitely, like those are the benefits in the postpartum. And then of course, like, women can use it for birth control and monitor reproductive health, like all the other things that we talked about, um, can be useful outside of pregnancy or after pregnancy.
Okay, no, that makes sense for sure. So when you are working with clients, what are some of the symptoms or biomarkers that uh, I guess trigger further exploration of the symptoms or of those markers, like something that would be a sign that they should be looking into what's going on further rather than it being something that's kind of considered quote unquote normal. There's certain PMS symptoms that many women experience and aren't necessarily a trigger for concern, whereas other things might be of more concern. So are there certain signs or symptoms that you and your clients tend to look for specifically?
Yeah. So, we always want to talk about what are the normal menstrual phases, and what are we looking for? in regards to mucus, for example. So, you'll have your period, which will be anywhere from 5 to 7 days, and then you'll have a period, and then you'll have a phase where it'll be dry and you won't notice any cervical mucus. And then, you enter your mucus phase, which can be anywhere from 7 to 9 days in terms of length. And then, after that, after ovulation, then you have like a dry phase for the rest until the start of your next cycle. So one thing to for sure be on top of is like, are you producing enough cervical mucus, or do you have too much cervical mucus? That could be a sign that your hormones are out of balance. If you have, when we're talking about PMS, like PMS can be divided into 4 different categories. You can have like there's the anxiety category of PMS, there's the depression category, there's cravings, and there's headaches. And so you have like symptoms under each of those categories that relate to those. So for example, anxiety, like it might be that you have insomnia, you're irritable, you're having mood swings, you're having panic attacks, you have like mood issues. Um, and then like, headaches, you can have fluid retention, fatigue, constipation. Like there's a bunch of symptoms that go under each category. So you want to be recording not only what PMS symptoms you have, but the intensity of it and what days you notice them. Like, are you getting PMS like that whole 2 weeks after ovulation, like before the onset of your period? And then when you get your period, do the symptoms just go away, or do they like get worse? Because if that's the case, then that's not PMS. That's hormonal imbalances. PMS usually is going to last for a couple days. It's going to be fairly mild, and then it's going to go away when you get your period. Of course, just because it happens and it's common does not mean it's normal, and does not mean that there aren't things that you can be doing to help manage your symptoms. But knowing when it's happening in your cycle gives me, as the provider, information about how that could be linked to your hormones. So for example, like I'll just give you like an example from a chart. So if I see that a woman has low temperatures after ovulation, and has increased cervical mucus after ovulation, and has a lot of PMS symptoms, we know that basal body temperature is correlated with your progesterone levels. So if your BBT is low, chances are your progesterone's low. And if you're having increased cervical mucus, well, we know cervical mucus is produced from the cervical crypt cells in the cervix in response to estrogen. So now we have a picture where it's the second half of your cycle, progesterone should be the more dominant hormone, but perhaps estrogen is actually the more dominant hormone. And we can see that by looking at those two markers, cervical mucus and basal body temperature. And then we layer on top of that the intensity of your PMS symptoms. Then, in my mind, it's like, okay, there is what we call an estrogen dominance picture there, where, you're producing too much estrogen relative to progesterone at that phase in your cycle. So that is a situation that would need addressing.
Okay, cool. Now, most of the factors that we've talked about today are during your follicular phase and your the word is
Luteal
escaping
phase.
me. Yes, thank you. But are there specific details that should be tracked during the period as well, beyond just symptoms?
Yeah. So when you're talking about your period, you want to track the quantity. So in the Justy's method, we use like HML and VL for heavy, moderate, light, or very light. And then you also want to be starting to track your cervical mucus on your light and very light days. During the heavy and moderately heavy days, you can't really differentiate the mucus because the blood is really heavy. But on those light days, you should be tracking your cervical mucus, especially if you're using it as birth control, because we know that sperm can survive in cervical mucus for 3 to 5 days. And if you're an early ovulator, then that could potentially, like, intercourse on that day could risk a pregnancy. Yeah, so those are important. And then symptoms. I think that a lot of people already are kind of doing that. But it's also important to, like I'd mentioned before, like rate your intensity of your symptoms. Because again, if you do something different, whether that's a diet change, lifestyle change, or a supplement change, you want to be able to track that on your chart and see the difference from a quantitative perspective.
Right. No, that makes sense for sure. So do you prefer apps for your clients or a manual log?
Yeah. So definitely when you're first learning a chart, it's a lot easier and simpler to record it on paper, to do a paper chart. And I prefer that when I'm teaching clients at the beginning, just because it's a lot to like wrap your head around. In terms of apps that, in my opinion, are customizable and as flexible at recording data, there are very few out there. There is one that has come out fairly recently in the last couple of years that actually like does work with various fertility awareness methods and educators to implement those customizable features of all the methods, and that app's called Read Your Body. And I usually will first have clients use paper, and then when they're confident in their routines and in using the method, then I will coach them on, okay, how do we take this chart and modify it in the Read Your Body app so that you could use this app to track the same data. And we're like, the Justice College is working on creating templates to make that easy, but for the most part, women, if they just download the app, like it can be a bit confusing because there's a lot of information there, like how do you customize it? So I would recommend, watching a tutorial on how to like navigate the app, because while it's customizable, that could be overwhelming for some people.
Awesome. Well, thank you so much for chatting with me today. This is a really fascinating topic, I think, and one we could probably talk about for hours if we wanted to. There's so many little details to go into and cover, but unfortunately, we've run out of time for today. So if our listeners wanted to work with you, what would be the best way to go about doing that?
Yeah, so they can find all those details on my website, which is www.antoinetteFalco.com. You can also reach out to me on Instagram. I'm at Dr. Antoinette Falco. Yeah, and reach out to me in either way, and we can have a conversation about what working together might look like and whether it's the right fit for you.
Awesome. Thank you so much again. This has been amazing. I really enjoyed chatting with you today.
Thank you so much. Likewise.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca.